with Hospice and Home Care of Reno County. I'd like to welcome you all to our first course event tonight. We have several people that want to talk to you about palliative care. It is a new program that is being offered to you by our agency and funded in large part by Hutchinson Regional Medical Center. The presentation will be brought to you by Dr. Mark Yackley, who is our medical director, Janet Grillo, who is our nurse practitioner for the program, Elizabeth Terry, she is our medical social worker, licensed master social worker, and we have two of our program, what do you want to say? One person that is currently on our program, which is Thelma Moody, and then another that her husband is on our program right now, Cheryl Sisler, and they are both going to present what the program has done for them and what it means to them. So again, welcome, and we'll let Dr. Yackley start the program.
Good evening. Hope you all can hear me. If not, please let me know. I see a few familiar faces and some unfamiliar faces. I gave a similar presentation back in the fall, in November last year, regarding hospice care. Tonight's topic is going to be on palliative care, which actually palliative care has actually developed its roots from hospice care. But as you can see, palliative care specializes on both the patient and the family, and it's specialized medical care for people with a serious illness. And this can be at any age and any stage. Whereas hospice usually is for those who have a terminal illness in the last 6 months of their life, or determined that they have less than 6 months of life expectancy. Whereas palliative care, that's not the case. It can be for anybody at any age. And also what's important and distinctive about palliative care is a person can also be receiving treatment, such as those with cancer can still continue to receive chemotherapy, whereas on hospice, oftentimes people realize that that is the finality and they usually end up not having treatment. Whereas palliative care, they still can continue treatment. Maybe they give treatment a little hiatus to get a lot of their symptoms under control, such as pain, nausea, or other symptoms that may come along with their particular illness. Palliative care is very goal-driven, especially between patients and their families. We work particularly with patients and families to meet their individual goals. Everybody, their goal is not necessarily the same. So we try to individualize and specialize their care, their needs, to what they require at that particular time. As you can see here from this slide, this also gives you a little demonstration of where and when palliative care can come about. And it can come about at any time in a person's medical illness, whatever that illness may be. And we also focus a lot on other issues such as the spiritual and psychological aspects of the disease and how it affects that particular person and family, not just how the medical disease affects the person. So that is very distinctive versus routine medical care where you come into the emergency room or a hospital and you're focused on doing everything you can to, get this person through that particular illness, and oftentimes you miss what can be very important to the patient and their family. You miss the more intangible items, such as the pain, how it affects them and their family. Some of the benefits that we've seen with palliative care is it not only helps you and the families, but it also helps the physicians. We're not we're not to take the place of your primary care physician. We're going to be that extra blanket of support between you and your families and your primary care physician. So that is oftentimes very helpful when your family doctor may not be available or may be, busy to take the call, or may not be real in tune to those particular needs. That's where this type of program can be very helpful, when you have nurse practitioners and social workers that are very available and ready to take your calls. Also, palliative care programs have actually seen a reduction in emergency room visits. They've seen reduction in admissions to the intensive care unit. They've seen reductions in utilization of drugs and reduction in prices of those drugs and other things that have been passed on to hospitals. This eventually, overall, will affect, the rising cost of health care. But you're going to see it directly in terms of how it benefits you and your families. And as you will hear later on this evening we have two participants in the program, how they have been touched and changed by our program. And with that, I'm going to turn this over to our nurse practitioner, Janet Grillo.
Hello. I'm one of the two nurse practitioners that currently work with palliative care, and my name is Janet Grillo. I have a passion for palliative care. I think it's incredibly important. And I just wanted to share a quote, and I hope that's okay, but a patient's family member gave me this quote that came originally from Stuart Scott. He was an ESPN anchor, and he said, "You can beat cancer by how you live, why you live, and in the manner in which you live." And I know that's real specific to cancer, but I love that quote because it is really what we do in palliative care, is we want to make sure how you live, why you live, and in the manner in which you live. So we talk about specialized care and how we want to improve the quality of life. So our main focus is the goals of the patient and the goals of the family members as well. And we want to support both the patient as well as all the family members that are involved. And you'd be surprised how often that the goals of the family members may not actually be the goal of the patient. And so we want to have that be the first thing that we address when we go into the house. And we want to be able to support that person and their family during, while they're seeking treatment and even after treatment, because if their goal is to stay in their house, then we want to make that happen for them. Sorry, I was on the wrong slide. Who can receive palliative care? Patients that are still seeking aggressive treatment for a chronic illness, and they may have multiple illnesses. So we want to think about the patient that might have cancer who's receiving chemotherapy, a person that might have kidney failure that's receiving dialysis, maybe a multiple sclerosis patient who's receiving treatment for her MS. So there's a multitude of patients that we could help. Anyone with a serious or chronic illness that's having symptoms or side effects of that treatment while they're receiving treatment. It's a team approach, so there's a lot of people involved, but certainly Dr. Yackley, as well as the patient's primary physician. Maybe there's a specialty physician that's involved, an oncologist, a pulmonologist, potentially a cardiologist. There are two nurse practitioners that see patients in the home. Myself and Jane Bailey are the two nurse practitioners that are currently working in the program, and we have a master's prepared social worker, and she does a wealth of things, and I can't begin to tell you all, so I'll leave that for her. Where can palliative care be provided? Palliative care can be provided in the following locations. In the hospital setting, if it's an inpatient setting and someone's having uncontrolled pain, we might be consulted to see that patient while they're in the hospital. At home, maybe they're receiving chemotherapy and their side effects are happening after their chemotherapy treatments, and now they're at home dealing with nausea, vomiting, diarrhea, constipation, pain, a multitude of symptoms. As well as the nursing home. Maybe they're in a rehabilitation setting and they're trying to get stronger, but they're having pain while they're doing their physical therapy. So all of those locations we can provide care. The next question I think is important is, how does someone get palliative care? I tell people, ask for it. Ask your doctor, is this something that could be appropriate for me? Could maybe my loved one benefit from palliative care? Tell your doctor about it, tell the nurse that's taking care of you, even tell your caregivers. Maybe you have a caregiver in the home that hasn't heard about it, and you can show them the flyer and say, hey, do you think I could benefit from palliative care? Some things to think about, and I'll just use this as a yes-no question. And if this answer to this question is a yes, do you have anyone, or do you have one or more serious illnesses such as the following: cancer, congestive heart failure, kidney failure, liver failure, a neurological disease like multiple sclerosis, Parkinson's, Alzheimer's, any of those diseases, then that would be a yes. Some other things to think about: do you have symptoms that make it difficult to be as active as you would like to be or impact your quality of life? These symptoms might include pain. Maybe you can't do the things you want to do because your pain isn't controlled. Maybe you're short of breath, so you can't go out to eat like you'd like to. Maybe the fatigue is overwhelming. Nausea, vomiting, diarrhea, constipation. And when we talk about behaviors, a lot of times for us, that would be an Alzheimer's patient or a dementia patient, maybe in a nursing home that's having behaviors. And we might be able to help with that and see if there's a reason why they're acting out, or if we can help with some of those behaviors. Also, weight loss and loss of appetite. That's huge when someone's seeking aggressive treatment, that we keep their appetite up and we try to limit the weight loss that they're having. The next question is, have you or someone close to you experienced any of the following: difficult side effects from treatment, eating problems due to serious illness? If you're nauseated, nothing sounds good. If you're vomiting, you have a fear of eating. If you're concerned about choking, you might not eat something that has a good amount of protein in it. Do you have frequent emergency room visits? An emergency room is not the place to treat nausea from chemotherapy. It's not the place to treat pain from a chronic illness. So those people, as well as they do a great job, they are strangers. So let someone that's familiar with you kind of see if we can prevent you going to the emergency room if at all possible. Are there 2 or more emergency room visits, or possibly even a hospital admission within the last 90 days? So these are all people that could benefit from palliative care. Do you or someone close to you need help with the following: knowing what to expect? Maybe this is a brand new diagnosis and you just got told something that's somewhat devastating and you forgot to ask a lot of questions. Knowing what the program and the resources are available to you. Maybe you have no idea all of the resources that could benefit you or your loved one. Making medical decisions about treatments or options, weighing the pros and the cons, or the risks versus the benefits. And I think that's really important. You know, is dialysis going to make me feel better or make me sicker? Is chemotherapy going to give me better quality of life or make me sicker? So I think that I welcome people that have questions regarding any of those things to ask for palliative care. And most importantly, do you or someone close to you need help with coping with the stress of a serious illness, emotional support, spiritual or religious support, or just talking to your family members about your illness and what's important to you? That last line is huge. Sometimes people don't talk to their loved one about how they're feeling and what their wishes are and when or if to continue treatment. So we try to help with all of those things. And as Darla mentioned earlier, we're funded by a grant through the hospital, but it's also a covered Medicare service. So Medicare pays for us to come to your home and help you be successful while you're seeking treatment. And if for some reason you don't have insurance available, we want to make sure this service is available to everyone. So we do have financial assistance available. It is a grant funded, and I think that you would find the guidelines are quite generous at 300% of the income poverty guidelines. So, and with that, I'll welcome our speaker, Thelma Moody.
Hi, I want to tell you about my new friends. Just a few words. They're kind, caring, make me feel comfortable, knowledgeable, and that I can call them 24/7, and that's very encouraging. Gave me ideas on how to get more liquids, gain some weight. All together, they've been such a blessing.
Hi, I'm Elizabeth. I am a master level social worker, and living with a serious illness, as many of you may know, really can impact so many different areas of our life. There's so many personal changes that can happen. Here we live in a society where we have learned to be as independent as possible. We've taught our kids that, and we've grown up to do that. And now all of a sudden we're faced with this serious illness that is affecting that. Not only can we may not be able to drive a car anymore, but even different chores around the home can be problematic. Even taking care of ourselves can now be problematic. So there's so many personal changes that can happen as well. We've also seen maybe now that we can't do these, we're having to have more dependence on other people, people that we may not want to depend on. Now we're having to find rides to the doctor or whoever. And so we have this increased dependence on others as well. This can also affect our relationships with our loved ones. It causes stress as well. Changes in home setting can also be stressful. Maybe now that we can't do some of these things at home, now that we can't do some of these things at home by ourselves, we're having to have more people come into the home to help us. Or we're having to change our home, making remodeling changes, maybe in the bathroom or something to meet those needs. This can also cause a lot of financial changes as well within our life. Now that we may not be able to work, and all of a sudden we have all these increased expenses because of our serious illnesses. So there's a lot of financial changes that can happen as well. Maybe having loss of income for our caregiver. The loved one that's helping take care of us now can't work as much as he or she would like to because they're caring for us. And so there's a decrease in income there as well. There's also a lot of increased expenses living with a serious illness. The equipment, maybe having to pay somebody to come in and help us around the home. There's a lot of home changes, and possibly maybe even having to look into a nursing home placement as well. So many different changes within the home. The financial changes can just be dramatic on us. There's a lot of emotional changes that can happen, obviously, because of this, with this increased dependence on others and all the loss that we've now suffered. Just because we're still here doesn't mean we haven't suffered loss. And those losses can really affect our emotions as well. It's very common to have increased guilt or depression or anxiety because of this. Caregivers, our loved ones, now all of a sudden having to have all these additional roles that they may not know of, that can cause a lot of fatigue for them. And having that additional support for them as well is very important. We're also learning to function at a level that we haven't had to function at before. Learning to allow others to help us. A lot of emotional changes. So what is the social worker's role within palliative care? The social worker is trained to look at the whole person, body, mind, and spirit, with that patient's own unique settings. Everybody is unique, everybody's individual, and your needs are as individual as you are. Helping find that support that you need is going to take assessment on a regular basis so that we can make sure that you have all the information that you need to meet those goals and needs that you now experience. We're going to use a team approach and offer that support for the patient, not only the patients, but the family as well, so they are able to cope with this serious illness and function at the highest level that they possibly can. We also are going to do it with dignity and respect for each of your individual beliefs and desires. Our goals are your goals. We're going to, as a social worker, we're able to provide intensive counseling as well as practical needs. Problem solving and interventions can include numerous things, but we're going to provide options so that you guys can make the best decision that's for your needs. Resources. There are all sorts of resources out there, both within the community and federally. There's also a lot of nonprofit organizations out there that offer resources. Definitely financial needs are very, very common within those that are experiencing this serious illness. So there's all sorts of ways that we can help out financially, finding those applications out there and help and assist with those applications, because the last thing that you want to have to do is worry about filling out a 20-page paper to get that help that you need. So we're there for that as well. We also are going to be there to support you in making those long-term care planning and changes that you might have to make, as well as advanced directives, DNRs, DPOAs, living wills, and to explain those, because sometimes those haven't been explained the way they need to be. And last but definitely not least, we're going to help you find the goals that you desire and then help you to find the resources that you need so that your goals can be successful. So now I would like to introduce Cheryl Sisler.
Good evening, everyone. My name is Cheryl Sisler, and our journey started in March 18th on my husband's 53rd birthday. And just bear with me because he is in the hospital right now. But I wanted to come over because the palliative care team has been so supportive for my husband and I. Darn it, I didn't want to cry. Let me get myself together a minute. This is just not easy. We didn't expect this at this age, and it can happen at any age to anyone. When my husband was diagnosed with cancer, he ended up in the hospital with pancreatitis for 2 weeks and was sent home with a pump pouch.
And in order for my husband to be taken care of in the best way possible, it was decided that the cancer doctor will take care of the cancer, and our primary care physician would take care of the pain management. And so the palliative care team was brought in. And that was the best decision that we could have ever made, because they are the kindest, most knowledgeable, caring individuals that you will ever meet, that you will ever want in your home to take care of either yourself or your loved ones. And I mean this from the bottom of my heart. I don't know what I would have done without their support and without their help, because I also have a father that last October I started taking care of as well. And so within the last year, the two most important men in my life I have had to take care of, and the relief and the release that was given to me through the palliative care team to be able to focus on my husband, focus on my dad, you know, take care of what needed to be done in my family. I just can't say enough about how, if you need palliative care of any kind, they are there 24/7. You pick up the phone, you call them, they will be either direct you to a nurse that's on call, and if whatever you tell them, even if you tell them, I want you to come, they will be there immediately. So in saying all of that, I hope you understand I've been in the hospital with my husband. I look a mess, but it's life. Life happens to all of us at every age, every circumstance, but we're all the main thing is that this resource is here for you, and I would recommend it to each and every one of you, because I am so thankful for them. It's just been tremendous. And I don't know if I should tell you this or not, but I mean, they go above and beyond. My husband and I were in the process of moving before he ended up in the hospital with pneumonia now and everything. But they actually are going to even help us move, you know, so, you know, they're just wonderful. And I don't want to rattle on. I hope I'm making sense, but I am just so grateful, and I just cannot express that enough. It is something that you really, really would want to check into if you ever have this need of pain management. It's pain management, and it has helped my husband so tremendously, and we are so grateful. Thank you.
Thank you, Sharon.
Does anybody have any questions for us that maybe we could answer? He's going to bring you a microphone so we can make sure we hear you.
All right, the situation, okay, I live here alone. My family is at least 12 to 20 hours away. In case of an emergency, is there people in your group that would be a communicator between my situation and to them, so somebody could have the time to explain what's going on?
Absolutely. We do a lot of information visits, and we actually answer questions on the phone all the time. But if you were to be on our service and something were to happen after hours, because we know things that aren't planned don't happen Monday through Friday, 8 to 4:30. So we do have an on-call service that takes the phone call, and they try to answer your question, and if they're unable to, they directly call us. So we could either come out and see you if that was necessary, if you were having a problem at or we can contact your family for you, any of that.
Okay, well, I mean, like in the case of a car accident, and I wind up in the hospital, would somebody be able to get a hold of my?
Yes,
yeah,
absolutely.
state?
We have a very good working relationship with the care management here at the hospital, and they either alert us that a patient is in the hospital, or we find out just because we've been notified one way or another, and then we would be able to contact whoever you decide you want us to contact.
Okay, thank you.
You're welcome. There's one over here.
A couple of times in your slides you had the acronym of DME. I'd like an explanation, please.
Sure. That would be durable medical equipment. Sometimes what you need is not actually a problem with your pain or a problem with your symptom, but maybe you have an oxygen concentrator and at 2 in the morning that is malfunctioning. So anytime there's durable medical equipment, it's a machine, it's made by man. I apologize, but it is subject to fail. So sometimes you don't know what to do or how to process that, and we work with Health Equip to try to, they have people on call as well, and so we can get that, that item fixed for you, or if need be, go get you a different one. So, good question. Any other questions? I might not have all the answers, but I do want to thank you all for coming. So it's kind of intimidating to look out to a big crowd, but I can tell you what I do all day, and I think everyone behind me feels strongly. So if you ever have a question, our phone number is on the back of the flyer. You're welcome to call and just ask us a question. If you think someone in your family might benefit from our service, we'd be happy to come out and talk to you as a group in your family, or just answer your questions over the phone. So we welcome.